I want to talk to you today about mitral valve regurgitation. To explain this better, I want you to imagine that my body is a chamber in the heart called the left ventricle. The left ventricle is a very powerful chamber that pumps blood around the body. It's a very muscular chamber. It's the most powerful chamber in the heart. You can imagine it's got to be powerful because it's got to pump blood everywhere, all the way to your brain, all the way down your arms, and all the way down to your feet. So it's got to be powerful. Now, imagine that my head is a chamber called the left atrium. This is a chamber that collects blood from the lungs before it passes it to the left ventricle. In between these two chambers is a very important one-way valve, the mitral valve, that opens to let blood in from the left atrium to the left ventricle and closes when the left ventricle contracts to pump blood around the body. This is its motion. Now, the mitral valve is made up of two leaflets, an anterior leaflet and a posterior leaflet. Now, what stops this mitral valve from turning the wrong way when the ventricle contracts is that it's attached at its edges by strings called chordae that attach to muscles called papillary muscles inside the left ventricle. So the normal motion is open, close, open to let blood from the left atrium into the left ventricle, close when the left ventricle contracts to pump blood around the body. Now, when these strings elongate, these leaflets can turn the wrong way. Sometimes it's a posterior leaflet, usually it's the posterior leaflet actually, sometimes it's the anterior leaflet, and sometimes it's both leaflets by leaflet prolapse. And what happens then, of course, is this left ventricle pumps hard, pumps some of the blood around the body, but some of it goes backwards and puts pressure on this left atrium, my head, the left atrium. And this left atrium starts to distend. Now, on this left atrium is an area called the left atrial appendage. It's a little cat's ear. And it's a very important area because as this starts to distend, this chamber can start to become irritable and irregular and develop a condition called atrial fibrillation. This is really important because when you develop atrial fibrillation in this cat's ear, the left atrial appendage, clots can form, and these clots can fly off into the circulation and create stroke. So it's very important to try and prevent atrial fibrillation from developing in patients who have got mitral valve regurgitation. So it's very important that if you've got mitral valve regurgitation, we know how severe it is, we know what's causing it, we know if it's progressing, and we want to know whether it's causing any irritability or any high pressure downstream, particularly in the lungs. We call that pulmonary hypertension. Now, generally on the whole, if you've got severe mitral valve regurgitation and the probability of being able to repair that heart valve is more than 95%, and for that your surgeon will tell you, then even if you don't have symptoms, even if you haven't developed atrial fibrillation, even if you haven't developed pulmonary hypertension, you are better off having surgery to prevent these things from happening. Because as I said to you before, you don't want to develop atrial fibrillation because once it starts, it's very difficult to get rid of. And it develops a situation for you long term, which will mean that you'll need to be on a blood thinner. It'll reduce heart function. And it's a risk that you really just don't want. One of the most frustrating things we as mitral valve surgeons face in clinical arenas is a patient who's been known to have severe mitral valve regurgitation to a very repairable valve, and they're not referred until they develop symptoms or atrial fibrillation. That is just too late. So if you've got severe mitral valve regurgitation, and particularly if you've got a repairable valve, you should be referred to an expert for mitral valve surgery. There are a number of ways to treat it. The best way is surgery. Breastbone surgery is the commonest way to do this. The problem is the breastbone takes 12 weeks to heal. It's a big bone break, and you've got to do certain things post-operatively to kind of avoid heavy lifting. More and more surgeons around the world are now performing mitral valve repair through a small cut around the nipple in men or underneath the breast in ladies. There's no broken bone. It heals in 7 or 8 days, and the randomized trial data is now telling us that at 4 weeks you will recover so much more quickly if the operation is performed by an expert. If you're really unwell and you're not suitable for surgery, then we can avoid using surgery at all in you and use a technique called Mitraclip, which is a way of clipping this naughty leaflet to the other less naughty leaflet. And instead of you having then one hole through which the valve was flowing, you've got two, like this, like a figure of 8. And this can reduce the amount of leak and make you feel better. So even in patients who are not suitable for surgery because of risk, either age, or you've got lung problems, or you've got other kind of, say, perhaps kidney problems that mean that surgery is going to be too risky for you, we can still help you with a technique called Mitraclip. Mitraclip is a very simple deployment technique through a groin while you're just under light anesthetic, where we pass a catheter through the heart and we just clip the leaflets together Sometimes one, sometimes two clips are required. It needs to be done by experts, but more and more surgeons, cardiologists around the world are now delivering this in suitable patients. I hope that helped. See you soon.